Coffee is not meant for your rectum. What's going on, everybody? It's Dr. Sudicky here, and I have another video for you today that I never thought I'd have to make because one would hope that common sense would prevail and these types of medical cases would never get published. But they keep coming up in the literature, and I thought it was finally time to talk about coffee enemas because yet another case study was published this past fall. But let's start by going back in time. This is 2010, almost 10 years ago, in the American Journal of Gastroenterology, where even back then, the risk was clearly outweighing the benefit. This is another case. This one was a 60-year-old woman who was admitted with bright red blood coming out of the rectum with severe abdominal pain after trying to mix 2 tablespoons of coffee with water that went into the rectum. She kept it there for 10 minutes, came in to emerge feeling awful, and not surprisingly, when they performed their scopes, they showed a lot of changes that didn't look good. Multiple ulcers in the sigmoid colon, multiple ulcers in the rectum, and again, not surprisingly, a strong recommendation not to perform coffee enemas. Coffee enema has no proven benefit and carries considerable risk of provoking unwanted complications. I hoped that these would slowly taper off over time, but they're continuing, and it's because a lot of health practitioners continue to make very strong claims around coffee enemas, including for cancer, which is really concerning. So here's another case just published this past fall. Looks like this was at a gastroenterology conference. So again, this is just a case study. So a case study is where a very interesting case that is so unique comes across the plate of a physician or somebody in practice that they feel that it is so different and so unique that it provides unique benefit to the literature, so they decide to publish it. And I'd say that these are important to publish because people continue to make claims about the benefits of coffee enemas. So it would be important to keep publishing the adverse effects, including severe adverse effects, in the literature so we can point to the evidence and show that it does come with significant risk. So 10 years later, here it's almost 2020, and here's another case study that's published. Proponents of coffee enemas advocate for its role in cancer treatment, where it's believed to detoxify via vasodilation and toxin excretion. Sounds explosive, doesn't it? However, there is no evidence, there's no science-based evidence to verify these claims, and its use is associated with harmful effects, including electrolyte imbalances and death. We present a case of coffee enema-induced proctocolitis. Essentially, this was a 40-year-old woman who came in with acute abdominal pain, and it sounds like she had some gallbladder problems and had a alternative physician or a naturopathic doctor, I think, who was recommending coffee enemas to treat her condition. So when she presented to urgent care, she had severe abdominal pain, she had a white blood cell count fairly significantly elevated at 21.8. Her CRP was elevated at 23. She was pretty unwell, and she admitted to using 500 milliliters of coffee enema to treat gallstones hours prior to symptom onset. But unfortunately, the coffee, quote, never came out. So flexible sigmoidoscopy showed severe rectal inflammation extending to the 60 centimeter depth mark. This was an unwell woman, and she had a lot of inflammation in the colon that they ended up having to treat with steroids. And after a slow course on the 13-day mark, she was discharged home. Now, you're welcome to see the pictures for yourself to see what the scope looked like. I won't put them on the screen to save you seeing it if you don't want to. However, it's pretty clear that there was something that was putting her colon at significant risk of serious complications. You can imagine that these people would be at risk of perforation eventually. Here's where it gets more interesting though. Our patient planned to follow up with her naturopathic doctor who recommended the enema. She blamed herself for using too much coffee and could not be persuaded that coffee enemas pose more risk than benefit. And of course, the conclusion of the paper is, or this case study, it's imperative that we educate people on the risks of natural remedies and work to develop trusting relationships with patients so they accept evidence-based practice. A lot of people with non-specific symptoms of abdominal pain or fatigue get frustrated because sometimes these symptoms make it difficult to find a diagnosis quickly and offer a definitive, quick intervention that improves those symptoms. And that's where alternative treatments thrive, like coffee enemas, for example, where somebody can say, I have the solution for you. It'll only take a half liter of coffee in your rectum and I will fix your gallbladder problems. And it sounds convincing if the delivery's smooth and confident as they ask for your credit card and your money. But just know that a lot of these treatments, including coffee enemas, have no evidence of benefit and come with significant risk of harm. So all I ask is to put on your skeptical hat. If somebody is making a strong claim that sounds just almost too good to be true, especially if they're asking for your credit card. So I hope you enjoyed today's video. If you enjoyed it, be sure to subscribe and hit the notification bell so you get notified every time I post a new video.